Do you know, or maybe you have an issue with a wound that just won't heal no matter what you've tried? Well, we're here today to talk to some folks at the Wound Healing Center, part of Garden Park Hospital in Gulfport. Marion is registered nurse here and wound healing specialist, right?
Yes, yes, certified in wound healing.
Mm-hmm. Tell us a little bit about your background and what got you involved in this.
I've been a nurse 29 years. The last 5 of it has been in wound care. Kind of fell into it, and it's my passion. I love it. Saving someone's extremity, changing their life, preventing an amputation, that's very important. And so I'm very passionate about it.
So if we're talking about severe wounds, I mean, if somebody gets a little cut or something like that, no, you're not going to be really, unless it gets totally majorly infected and their hand's about to fall off, you're not going to deal with that. But tell us the kind of patients that you do see here.
So frequently we see diabetic patients, patients that have chronic wounds that don't heal, patients that have wounds that reoccur. Our diabetic patients oftentimes have wounds of the foot, the lower extremity, that just don't respond. And so that's what we specialize. We do advanced wound care. We have special modalities or treatments to treat those wounds, casts, different kinds of dressings, topical creams or ointments, antibiotics, and even hyperbaric therapy.
Now, how would somebody know if they need to come to the Wound Healing Center?
So anyone who has a wound that doesn't heal in a reasonable amount of time. Most wounds heal in about 2 weeks, and if you have a wound that doesn't heal, it's not responding, then you probably need to either see your primary care or come to the wound care center.
Now, these people that have these wounds may not necessarily be from diabetes or anything like that?
That's correct. We also have patients that have chronic wounds of the lower extremities, venous stasis ulcers. People who have chronic swelling can develop a small break in the skin. Those can become burdensome and a wound that just won't heal. We also have patients that have had maybe radiation treatment for cancer and can have wounds that occur post the radiation treatments.
Wow. How many doctors do you have working here, Marion?
We currently have 4 doctors that are general surgeons and family practice. They work with us every day of the week. We're open Monday through Friday, and every time a patient comes, they'll see a physician. It's a physician-driven clinic.
Now, does somebody need to have a referral from their general practitioner to come here and see you?
No, they don't. If you have something that you are concerned about, by all means, pick up the phone and give us a call, and we'll be glad to see you, evaluate you, develop a plan of care, and treat you.
Now, what other kind of, what ways of treatment? I mean, you mentioned your I can't say it, the
hyperbaric oxygen therapy.
Yes, that thing. Talk about that.
Well, it is a treatment that is 100% oxygen. It's under an atmospheric pressure, so you'd be at 2 atmospheric pressures, and that helps the wound develop extra blood flow, extra capillaries at those sites, so that oxygen, nutrition, antibiotics can all get to that wound to heal it.
Okay. Well, we're going to talk to one of your patients that has been coming here and getting some wonderful success at the Wound Healing Center, part of Garden Park. Troy, how are you?
Good.
Good to meet you.
Good to meet you.
Tell me a little bit about yourself. Are you from down here?
No, I'm originally from Maine.
Uh-huh.
Moved down here because my grandchildren live here. While I was down here, I got a problem on my foot and had to go to a wound care, and I picked Garden Park Wound Care, and it was the best one I ever picked in my life.
Yeah, Garden Park Medical Center. I mean, they're well known in so many different areas of working with patients and everything that I've met with them in the past several years. But tell us your issue. I mean, you have had a problem with your foot.
I got a diabetic ulcer on my heel. And let me back up. It started out being a dry heel, and it cracked, started bleeding. So I went to see my doctor, and he sent me to the wound care, and I've been here ever since. And this is the best wound care I know of. I've been to a couple of them now, and I want to say this is the best one.
Now, what do the doctors do when they work with you? I mean, it's just not coming in and throw you in the hyperbaric chamber and pulling you back out after a little bit? I mean, there's more to it than that, isn't there?
Oh yes, of course there is. I mean, they come, and if you're a diabetic, they work with you to control your diabetics.
Nutrition, I guess, is an important thing.
Yeah, nutrition. They prep you for everything that's going to be done.
Yeah, let you know.
They're gonna,
no surprises.
Oh no, oh no.
That's a good thing.
That's a very good thing.
And then over a period of time, of course, you know, with the treatments and everything is what makes the big difference.
That's right.
So, you work with one particular doctor. I know there's 4 doctors here, but you get really close to them, I'm sure.
Sure. I'm so close to them. They're like family to me.
That's a good thing too. But you're doing great now.
Yeah.
Okay. Awesome. Awesome. Well, we want to talk to Marion a little bit more and find out more about the wonderful services that they have here at the Wound Healing Center at Garden Park Medical Center. Dr. Killebrew is general surgeon here at Garden Park Medical Center and part of the team here at the Wound Healing Center. Dr. Killebrew, pleasure
Jim.
to meet you.
Good to meet you.
Talk briefly, I know in Troy's case, of course, he did go to the hyperbaric chamber, but it's not necessarily for everyone.
We do all phases of wound care, and we treat the specific patient rather than just the wound. In Troy's circumstance, we tried the hyperbaric oxygen therapy in order to increase the flow of oxygen to his diabetic foot wound. Some patients that works very well, some patients never get this far. We are able to treat them with other modalities that prevent them the necessity of a hyperbaric chamber. Hyperbarics has some very specific indications. Carbon monoxide poisoning responds to hyperbaric treatment and pretty much only to hyperbaric treatment. We also use it in necrotizing wounds. But it's also useful in some diabetic wounds.
Okay. Now, what are necrotizing?
That's a type of bacteria, the proverbial flesh-eating bacteria that everyone, there's an article about.
I know, we hear about that all the time.
All the time.
Down here on the coast.
Yes.
But now, if somebody is in need of this, and their general physician says, you need to go there, I guess they just call and make an appointment
They could call and make an appointment to the clinic. And we can get them in usually within one work day. We're here 5 days a week.
That's awesome. Dr. Killebrew, thank you so much. It's a pleasure. And of course, the location is right next to the Garden Park Medical Center in the Garden Park Medical Building. And if you want some more information, the phone number is on your screen. If you or someone you love need some help from the Wound Healing Center here at Garden Park Medical Center, give them a call.